5 minutes.
Thank you very much, Mr. Chairman. And for 4 years, I was the vice president of an engineering and consulting firm that worked in rural broadband. And, we designed and put into place about 8,000 miles of fiber optic network a year, did a number of wireless builds as well. And I'm not sure there was anything more rewarding than seeing the real joy, the satisfaction of these communities that were getting connected to real, gigabit-type networks that they had not had access to previously. And I was particularly struck when there were traditionally underserved communities or sub-communities. And we've talked a fair amount today about demographic differences in broadband availability. I want to shift just a little bit to demographic differences in broadband adoption, or to what extent people are actually using the speeds that they can get access to. And of course, we often talk about this with regard to age. And so I was just curious for any of the panelists, if you want to share from your medical or tribal or agricultural communities, stories you may have about getting older Americans connected to these resources.
Well, I just start with one anecdote. We were actually going to apply for a PCORI grant to look at post-stroke care, and most stroke patients are elderly. And so before we did that and applied, we were going to use telehealth and actually connecting with iPads and smartphones to try to do follow-up with nurses. So we started first. One of the nurses said, why don't you do a survey and see how many elderly Americans with stroke have a cell phone or know how to use a cell phone? And the numbers were disappointingly poor. Most of them didn't have access to a cell phone. They may have had a grandchild or a child did, but they weren't necessarily in the house. And more than half of them didn't know how to use a cell phone nor how to use a tablet. And they were intimidated by that technology. Now, this was only 3 years ago. So I think when you get to, in terms of the health field, when you get to elderly people who have stroke, who may already have cognitive problems, that can be a problem. I think you're going to need someone in the family maybe to help them. Often, the younger you are, the more technology adept you are. So I think it is an issue with some of our aged patients. That's just my anecdote.
I would say also that it's about the adoption as you speak. It's when individuals can really change the way that they work, learn, and live using this technology. They won't substitute it. I mean, why our youth are no longer going to go to communities that do not have broadband. That will be a requirement for future employee, as our youth are looking for new homes. So once we have the technology and everyone has technology, it should be like electricity. Everyone should expect it. It shouldn't be some have and have not. Then they can use this new technology, provide better health care, provide better educational outcomes. They'll have that adoption rate. It will see the value to their day-to-day lives and how they care for their elderly parents or improve their own health. And then at that point, I think adoption will really be finalized.
And maybe for you, Councilwoman, I would imagine that dealing with tribal elders, sometimes it was hard for them to, you talked about the increase in the quality of life of people using some of these new speeds, but I'm sure tribal elders lagged in that access.
Mr. Johnson, you're correct. In the idea of public health, we are working on some crisis response protocols within the community, and we have set up kind of a public education guideline and system that we are about to deploy in regards to our state and Medicaid. Even the community themselves don't know what questions to ask when they are flown out of the canyon to a regional medical center. And we are just now establishing a question card. So in the idea of, as a community, Native Americans usually do a public outreach, and we'll have a community meeting where we'll invite the public, and that is where we would start.
And then for Mr. Hurst, all of my buddies in their 30s, 40s, and 50s who are ag producers are using technology a lot. My producer buddies who are in their 70s and 80s, less so. I'm sure my experience isn't unique in that way.
I mentioned my father in the testimony. I kid him, he's the only guy besides drug dealers that depends on a burner phone from Walmart. But he pays attention to those maths, so we're making progress, but there's definitely a generational difference.
All right, thank you very much.